Hello and good morning. I'm Casmar and my partner, Natalie Duran. We will be presenting glaucoma. There you go, next slide. So, what is glaucoma? Glaucoma is an eye disease that damages the optic nerve. The damage usually happens when fluid builds up in the front part of your eye. The extra fluid buildup increases the amount of pressure in the eye, which can lead to blindness. Glaucoma is the second most common cause of blindness in the United States and is the most single important cause of blindness among African Americans. Worldwide, it causes the most cases of blindness in East Asians.
So for the etiology of glaucoma, there's certain health problems that can cause glaucoma. This includes complications from medical conditions such as diabetes or high blood pressure, cataracts, like the presentation Mackenzie was doing with Caroline, certain eye tumors, inflammation of the eye, serious eye injuries, reaction to steroids used to treat some diseases. And other risk factors that can cause glaucoma include being over 60, being of Black, Asian, or Hispanic descent, having a family history of glaucoma, having corneas that are too thin in the center, or being extremely nearsighted or farsighted. So symptoms of glaucoma vary between the two major types. So there's open angle glaucoma. I'll be going into the types in the following slide, but for these symptoms, this includes patchy blind spots in the side peripheral or central vision, frequently in both eyes. There's tunnel vision in advanced stages. For another type, acute angle closure glaucoma, this includes severe headache, eye pain, nausea and vomiting, blurred vision, halos around lights, eye redness, and if left untreated, glaucoma will eventually cause blindness. Even with treatment, about 15% of people with glaucoma will become blind in at least one eye within 20 years. So going into the pathophysiology, basically, how can eye pressure damage the optic nerve? So the pressure of the eye will increase if fluid cannot drain out of it. Between the cornea, the clear front layer of the eye, and the iris, which is the colored part, there is a space called the anterior chamber. Fluid normally flows through this space and out of an opening where the iris and cornea meet. The opening has a spongy tissue in it, and the fluid passes through this tissue as it drains out of the eye. Whether you develop glaucoma depends on the amount of pressure your optic nerve can take without being damaged. So basically there are 4 types of glaucoma. The 2 major ones are the primary open angle and angle closure, and then the 2 other types are the normal tension and congenital. So primary open angle is the most common type. This happens when the eye does not drain its fluid as well as it should. This results in built-up pressure in the eye and it damages the optic nerve. Angle closure, this is where the opening of the iris and the cornea gets blocked by the outer edge of the iris. When this happens, the fluid can't drain out of the eye at all. So this constitutes a medical emergency. Another type is the normal tension. So it's possible for the optic nerve to get damaged and cause vision loss without high eye pressure. Experts don't know why exactly it happens, but it may be that the optic nerve is more sensitive than most people's. In this case, even though the pressure in the eye is normal, lowering it can slow down or prevent more damage to your eye. The next is congenital glaucoma. Babies are born with a problem in their eye that makes the fluid drain more slowly than normal. The good news with this one is that if the child with the congenital glaucoma gets surgery soon after they're diagnosed, they can get a high chance of developing good vision. So this kind of shows the difference between a normal eye and one diagnosed with glaucoma. So you'll see that there's the built-up of the aqueous humor fluid, the damage to the optic nerve due to the high pressure. So you'll see that the fluid isn't able to drain, therefore it's like increasing pressure in the eye.
So, to diagnose glaucoma, the best way um, to diagnose glaucoma is to have a complete eye exam by your ophthalmologist. During a glaucoma screening, doing a glaucoma screening is not enough to find glaucoma. During your glaucoma exam, your ophthalmologist will measure your eye pressure, inspect your eye's drainage angle, examine your optic nerve for damage, test your peripheral side vision, take a picture or a computer measurement of your optic nerve, and measure the thickness of your cornea. Treatment. So, sadly, the damage that glaucoma causes to the eye is permanent and cannot be reversed. However, modern medicine and investments in surgery have helped to stop the further damage. So, a good way to treat glaucoma is, having a healthy diet. That includes a diet high in green leafy vegetables, antioxidant rich foods like blueberries, goji berries, ginger, foods high in carotenoids like carrots, pumpkin, papaya, and sweet potatoes. And also consuming good amounts of omega fatty acids, which you can get from salmon, flax seeds, chia seeds, hemp seeds. And changing your lifestyle is also a good way to treat glaucoma. So that's cutting alcohol and smoking cigarettes, avoiding or having low amounts of caffeine throughout the week, and exercising 3 times a week. Oral medications we could take are beta blockers and carbonic andracise inhibitors, and these help improve the drainage or slow the creation of fluid in the eye. Also, you could take eye drops, and eye drops they help lower the eye pressure and help increase fluid to get out of the eye. Laser surgery is also an option to treat glaucoma, and there's different laser surgery procedures you can do, like a ederatomy, which is one procedure where they make a tiny hole in your iris and they drain and doing that allows the fluid to flow more freely out the eye. And also microsurgery. And a very popular procedure is a trabeculotomy, and that's where the doctor will drain the fluid from the eye to ease the pressure. So, research. Current research has helped physicians that have improvements in diagnosing, better methods for early detection, and better novel therapeutics that could treat or help with someone that has glaucoma. A common study patients might like to reference and refer to that have glaucoma is a study that was conducted in the 1970s, which found that glaucoma can be treated with the consumption of cannabis or marijuana. Yes, marijuana can lower pressure of your eyes. However, it also lowers your blood pressure, which can result in reduction of blood supply to your optic nerve. And we know glaucoma affects the damage of the optic nerve. And also, oh, that's fine. Well, yeah, also, alcohol is another thing. People with glaucoma would say, oh, well, alcohol, it lowers the pressure of your eyes. But yes, alcohol also does lower the pressure of your eyes. But we know when you have massive consumption of alcohol, it never leads to good outcomes. And next slide is our sources, and thank you.